So the next and the last topic of discussion for today, which is the 6th panel discussion, preventive healthcare, redefining the healthcare model. So we have discussed a lot of things, new technologies, new modern treatment, a lot of things have been discussed today. And last but not the least, we have reached a point where maybe preventive healthcare can redefine this complete setup. So we have discussed OPD and home care as well. So I'm definitely sure this is going to add the last, icing on the cake. So along with Dr. Vineet Sikka, the panelist for this session, we have Mr. Manish Dudeja. He is the Chief Operating Officer of Care Insurance. I request him to be on stage kindly. I'll give a brief introduction about sir. He's a founder member and Chief Operating Officer at Care Health Insurance, and he leads the product, underwriting, claims, reinsurance, finance, human resource, administration functions of the company. He is additionally responsible for establishing the organization's wellness platform and managing relationships with network providers. He's part of the core team working towards making Care Health one of the country's leading health insurers. He is having an overall experience of more than 2 decades in the general health insurance industries, managing principal insurance services processes across multiple locations and verticals. In his previous role with ICICI Lombard, he has worked on a wide cross-section of key projects and operations, technology and claims management. He is qualified chartered accountant by profession. Sir, please kindly have your seat. Doctor, please have your seat. The next panelist which we have with us is Mr. Karunakar T. I would request sir to be on stage. He is the CEO of Family Health Plan Insurance, TPA Limited. Sir is leading 2 rapidly growing wellness and health administration enterprises under Apollo ecosystem. With over 32 years of multi-sector experience, he is at the forefront of reshaping India's preventive healthcare narrative, particularly within the corporate sector. As CEO, he drives overall strategy, organizational growth, innovation and market expansion for both entities. At FHPL, he leads strategic directions and operational excellence for one of India's top TPAs, enhancing service quality. With a distinguished 19-year association with Apollo Group, he has led major initiatives in cultural transformations and talent development, reinforcing his foundation in service excellence and human-centric leadership. Over to you, Dr. Vineet.
Thanks, Saurav. So, it's a very, preventive is actually very close to me because around 6-7 years of my life, the last 15 years I've spent on selling preventive propositions to various corporates and PSUs. And we have moved to a level that a lot of time back, nobody wants health checks or preventive to be part of their program even. It was voluntary, very few people used to do it, and it was not considered important also. But for the last, I think COVID was an eye-opener for everyone for sure. But what we have seen, a lot of people gave certain figures on how NCDs have created all that panic in our lives today. But if you see, one of the common factors is you see a fatty liver that you find in a lot of individuals today. And you must be seeing a lot of content online on fatty liver and all these things. Surprisingly, I think 10 years ago when we used to receive any claim, I used to be in Max that time, any claim on fatty liver, it was a denial. Straight away saying that it must be alcoholic. Etiology would be alcohol. And without anything, it used to get rejected, and we used to kept on replying with those queries, query replies that no, etiology is something else. Idiopathic was a very common word. So we all are aware of those words. So we have gone from that level to now people understanding that this is non-alcoholic fatty liver, which is becoming a part of our lives, and a lot of people getting sick. And 70% of our claims today are from non-communicable diseases. So it's very relevant to talk about preventive. And that's why I think we are very privileged. We have Manish with us. Manish is a very senior veteran of the industry. And we have Karnakar sir also from FHPL. They both have seen this very closely in the last 10-15 years. So my first question would be to Manish. So Manish, preventive healthcare will reduce cost. A lot of people must have told you. They will come and they'll say, you spend more on preventive, give us less premium, we'll spend more on preventive, it might reduce your claim ratio and all those things. What do you think, is that the annual cycle we should still follow, or we should follow different models to make this approach successful? This is not wrong, but I think that approach needs to be defined properly. What do you think?
So thank you, Vineet. I think you very rightly said, and I think a couple of panels have also discussed this, that insurance has traditionally always covered hospitalization, and we've done piecemeal work on outpatient. As you rightly said, COVID, we did a lot of work on COVID, teleconsultations, etc. But the approach has always been limited to that annual plan in corporate. While in retail, it was always do indemnity, there is no utilization outpatient, and it was very difficult to structure outpatient at that point of time. I think now, with the regulatory landscape changing, I think we have a regulation which allows us to do multi-tenure on corporate side, which ensures that you have longevity of contracts, where the corporate is also willing to work with you to improve the health of the employee, as well as see return on the premium that he pays. Similarly, there's more work that we will have to do. I think it was touched upon in the previous session on the product that we develop. I think on the outpatient side, the whole ecosystem that we will have to develop to deliver that benefit will be key to see if we are able to structure a multi-tenure product or not. And similarly, I think on how do we promote utilization of those benefits again. It's good to have the utilization, but the reality is in retail also we all have annual health checkups in our policy, but still less than 20% people today use it. How do we make sure that this gets used more will be the key to finally seeing success on the preventive side.
Yeah, I think I have a follow-up question on that, but I'll come to you on that. But let's go to Karnakar sir first. So Karnakar sir, from TPA angle, from TPA side, what do you think, like insurance companies will talk about 2-year, 3-year premium, and then, so how do you think corporate approach you? A lot of corporates directly talk to TPAs also, and they want TPAs to get them a plan. So how does that approach works for you?
Yeah, actually it's a bit interesting in terms of whatever we have been hearing from day long in terms of insurance. Mostly it is a curative aspect which we've been hearing about. But what is very important, which is currently happening in the corporate world plus the country that we are in, is in terms of the NCDs, that is non-communicable diseases, which typically are taking or actually overtaking the entire healthcare space that any either an individual aspect or from a corporate angle it is getting in. And to your question, what as a TPA or as a wellness company that at least I represent, where we typically focus on corporate wellness. And whenever we talk about the cost that is involved, whether it is with an insurance premium, which we go to a corporate and say that, okay, these are the initiatives that we have to see that we can bring down the cost that is getting involved into the premium side of it. And how do we actually do it? Typically, this is not a activity which can just like that happen. This requires a lot of engagement. And some of the things that we do at Your Life, which is a wellness company, is working very closely with the corporates. And whenever we have this HRs doing the health checkups, mostly what happens is it is like an activity. They complete the activity and after that it is totally forgotten about. What we actually do from the wellness side of it is we pick up from there and we actually do a bit of an analysis of the data which comes out. And typically if you really look at the data, it is on the non-communicable diseases which are mostly getting reflected. And that data which we take, we get back to the corporates. There are some corporates who are very willing to work openly in terms of how they can improve the overall health of the organization. So we have different models available and we, depending on how the corporate is really looking at, we pitch in for those things. And we typically want to see that there is a value that is coming in for the investment that the corporate is doing with the companies. And there are certain organizations which are very actively working on and which we are able to show over a period of time that the overall premiums for these companies are slowly coming down. So this is a journey. I don't think it can happen in a way where you can see results immediately. There are a lot of large corporates with whom we are working in. Even entire health checks is free for the employees. But if you really look at the analysis in terms of what is the participation levels, it is actually in single digits. Reasons are so many, but how do we get them into the wellness side of it, into the health checks? Post that, how do we enhance the health of the individual, then the organization, is what would really matter.
Yeah, I think utilization definitely is our next topic, and I feel if we had some corporate guy also in this panel, then that question had been very valid for them. But Manish, on utilization, we spoke earlier also. What are the incentives that insurance company can think today? I know there are certain incentive plans that you have in your retail policies. So how is the success there? Is it you are experimenting right now, it's pilot mode, or what's the take there?
So so that's the moot question, Vineet. I think how do we make sure that be it an employee or be it a customer use it? And what we've seen is that you'll have to build some incentive and some motivation for be it the employee of the corporate or be it the customer to use it. So we've done multiple pilots in a particular corporate. We did a whole reward point program that if you did a health checkup, you got these many points and you can redeem these points. And we found more than normal utilization over there. In some of the retail policies, we do that. We allow for discounts on premium. We allow for no claim bonuses. So that is what I said in my when you ask. I think we'll have to structure a whole ecosystem around the whole product and what incentives we can give to the customer to be able to use that and improve his health in the long term, which can help him as well as his insurance company.
Yeah, I think few of the corporates are definitely serious about it. We learned from news about Deloitte India, which has made it compulsory for all their employees. TCS is another one who pushes hard. Now they've started doing on-site health checks also. So yeah, I think there are certain corporates
like
who are very
SBI, they do it.
Yeah, so a lot of corporates have become serious.
No, I think the question that you mentioned about Deloitte, etc. Again, what they did was they linked it to the KPI of the individual.
Yeah.
Once it gets linked to a KPI or an incentive or a punishment kind of model, it works.
You're forced to do that.
It kind of works there.
So maybe we are still in that fear will drive behavior in India forever. So, okay. So behavior change for utilization is something I think that Kundakar sir, on the wellness side also, Your Life and FHPL together, what are a company like Your Life or FHPL are doing in terms of driving utilization in these campuses? A lot of these corporates, you have your own desk inside, you have your OHCs inside. How are these OHCs and all these desks helping you increase utilization?
Yeah. On the OHCs, which I was touching upon earlier in terms of the corporate engagement, typically we have our occupational health centers inside the corporates. The main focus here is to see that how we can educate the employees on the ground in terms of the returns that can come in, whether for them or for their families. Because the most important thing that happens is beyond the employee, the family is a very important element for the overall health to happen. There are certain corporates where we have the occupational health centers. Our engagements have been much larger with the families. So we get the families into it. We have those camps organized wherein we talk about the wellness as a whole, which will help the overall family to be healthy. And these are things which are being continuously gauged from the HR of the organization to see how the participation is increasing. And the result that we see actually is with the families getting engaged more into these activities, the overall health of the employee or the organization is also making a huge difference. So these are certain things that we do in terms of seeing how the employee can actually participate, and not just participate, but beyond that, how do they change their lifestyles, the participation in terms of whatever, say, a dietary program is organized, how do they practice it going back home? Because at the end of the day, here in the office, you do a program, it would remain there. But when you get your family involved, those things are taken home, and those suggestions which are given by a dietitian is implemented at home. That is what is typically looking at in terms of the traction that we can bring in.
So with all these utilizations, and this is now from data standpoint, we collect a lot of data as, say, individual players. So hospitals will do their bit, collect their data. They will do the same things with the corporates or even in community programs. Similarly, TPAs and wellness companies and insurers also. This data that we collect today, is it helping us kind of creating a preventive first or insurance product? Do you see that happening, Manish, right now, or this data is still not very clearly available to you?
So, see, the good part has been that at least the insurance industry has IIB as a bureau, where there is 30 of us share data every month, every week. So there is a consolidation of data that happens. I don't think as an industry we've still found ways to use that data, again due to privacy norms, again due to competition norms. I don't think we found ways to use that data, but at least we have data of the insurance side of customers. There's a lot of work that I'm sure each of our companies are doing, as much as I know, including ours, is doing in using that data on the healthcare side, because to see how more products can we do, say, so many customers of ours suffer from diabetes today. Can we do a diabetes management program for them to make sure that we are able to handhold them through diabetes? So many of them go through cardiac events that we've paid for. Can we do post-care cardiac for them? So there's data and products that are going on, and there's a lot of data there. But I think what is needed is a more consolidated approach to data, because today Manish Dodeja in my database lies Manish Dodeja, and a Manish Dodeja in Apollo and Max and something else could be not comparable. So how do we correlate that? And I think there's a good start with the Abha ID that has come in. How do we use that to consolidate data would be the key to kind of take that forward.
Yeah, Kunakar sir, from your end.
Yeah, absolutely. Data is really fragmented. If you really look at, we have hospitals, we have clinics, we have say for example, the health checks that happen in the country or in the corporate. But this data is actually not getting to the next level. We just have that data, but we are not able to really see that how we can utilize it to see that there is a, what do you call, interventions happening on the wellness side of it, which can actually, if you do a health check today and the data is available, without interventions, say next time you again go for the same checks, your result would either be the same or it would have gone bit on the other side of it. So if in between interventions can happen with the data that is available, it would definitely make a huge difference in the wellness side of it.
So just this would be the last question. So if we have a model which is a consent driven model, where we tell, okay, certain section of people, they should volunteer and say that I give consent to my data, give me the best possible product and give me a best possible preventive cycle to me or preventive program to me that will help me become healthier. Will that kind of a model work? I know it is this was in my head, I really wanted to ask this question. So if people are ready to give consent, and we do give consent to so many apps today. Zomato, we give consent. We give consent to everybody. So everybody has our data. So we should not lie to ourselves that privacy and all those things. So we are actually giving data to everyone. So if there is a model that says, I voluntarily consent and give my medical data to insurance and the other partners, wellness, everyone, you give me a product that will make me healthier. Would you think that will work?
I think yes and no. I think there is a lot of work that has gone on. I think Anshul also mentioned it in the previous session on the product side of things. I think there's a lot of work that we'll have to do on the creating the ecosystem between the healthcare and the insurance for outpatient. Because without that ecosystem, I don't think preventive product servicing will work.
Okay.
I think sending a 1,500 rupee bill on which I spend 300 rupees to adjudicate that claim, both sides the PNL will not work. So I think we will have to create an ecosystem for servicing cashless. I think we solved UPI. It's our biggest win as a country of digital payments, and I'm sure this is the next stumbling block. If we solve it, I think will really fast track the outpatient care and preventive utilization in the country.
So Karnaka sir, you also through your life or any other programs, you must be taking consents already, right?
Yeah. There's some corporates which give the consent. Yeah.
So once you receive that consent, how that works for them? What kind of advice we are giving?
We actually do something called as a wellness cycle. It starts with the health checks, the data. Post that we analyze the data and categorize the employees into the risk that they are currently in, and then we do the intervention programs. And the engagement is such that we repeat those health checks for those set of people to see whether these interventions have actually made a difference or not. And that is actually we are able to showcase that with these interventions there is an improvement happening. And that is where employee also would be happy, and the corporate also sees value in what we are doing.
So it's tracked and shared with the corporate right
Absolutely.
now? Absolutely. Okay, one curious last question, sir. So a lot of people get health checks done in hospitals, clinics. A lot of them are healthy individuals. Reports are fine, normal. Are you interested in that data that should come to you? Yes. As if provider and insurers get together and say that, okay, we have to increase penetration also?
Yes, because that will drive the next product innovation that will come.
So what does provider get in return? So
the health check revenue.
Okay, so we'll leave it at that. I think Preventive is definitely one of the game changer topic for us in future. But yes, that data on both sides. Why I emphasized on data is because that will play a huge role in a lot of decision making that happens in future. But we are happy that in the last 6-7 months or 8 months, whatever is happening in our industry with insurers and providers and all, it has waken everybody up. And there is everybody who is thinking to collaborate and thinking to get into a discussion mode to solve things. So this is good. So whatever happens for good. So we'll keep it at that. Thank you so much. Thank you, Karnaka sir.
Thank you so much. I request Chairperson sir, Abhijit sir, to kindly felicitate. Thank you. I request Sridevi Madam to kindly come up on stage once. We have not felicitated Abhijit sir for his morning session, ma'am. Thank you so much. So with this we have come to an end of the very enriching session since morning today. And just while the photograph is being taken, just a few key takeaways which maybe we can all go back and explore upon. My takeaways although. Starting from the first discussion, having an emotional touch is always needed. And that is going to take us a long way to increase penetration. Role of regulator being instrumental. We have to stop, the payer and the provider has to stop seeing each other as adversaries, right? The technology, as we have all heard from a lot of eminent speakers, technology can play immense role in revolutionizing the entire healthcare delivery as well as the healthcare systems on the insurer side as well. Further, the technology should not be a burden. It should ease out things rather than being a cost burden, rightly pointed out by one of the speakers. OPD and home care, the new next in and should be capitalized upon. And last but not the least, data being the main source of all the things which we are all going after. And as an insurance company, as a provider, we all have a lot of access to a lot of data, which I think can be utilized in a better way to give that kind of service to the end user. Last but not the least, I would like to take this opportunity to thank the entire team who has been working for the past 2 months to materialize this event, coordinating with all the eminent speakers. I would like to mention a few names from Apollo, Amitavo and Priyanka, and from the Bengal Chambers, Sharboni Seth, Madam, Oindrila, and Abhijit sir, as well as Sridevi Madam, for being the guiding support as always. Thank you everyone for being a very patient hearing, for staying till the end, because that is also very important. Thank you so much.